Hi, I'm Captain Monique Napolitano, and I'm one of the 501st BSB Physical Therapists. Today I would like to show you a very simple way to tape the knee with kinesiology tape if you're experiencing knee pain while running. You will need rubbing alcohol to prepare the skin, a pair of scissors, and kinesiology tape or KT tape. You can buy this at the PX, at Walmart, Dick's Sporting Goods, or Amazon.com. It doesn't matter what brand it is. I'm using the original Kinesio tape, but any brand will do. Step one, we're going to prep the skin. We're going to clean around the kneecap and up onto the thigh. While that's drying, you can prepare your tape. Some tape comes in pre-cut rolls. I find buying one large roll is better because then you can cut it to whatever size or specification you need. So for the sizing, you're gonna want the piece of tape to go from the bottom of the kneecap and be able to wrap around to the top. And it doesn't need to be exact, but that's about how long. And everyone's going to be different, depending on your size. We want 2 strips. So we're going to cut a second one. And then so the tape doesn't peel up, I'm going to round the edges with the scissors. So I have 2 pieces, approximately the same length with the rounded edges, and then you also need to cut a 3rd piece. It can be a little bit shorter than the first 2 because this piece is going to be going here, right underneath the kneecap. So when we apply Kinesio tape, you have to keep in mind that the tape has a stretch component to it. So when we anchor the tape, we don't want to add any stretch to it. We're going to tear off small piece of the paper, and this is going to be our anchor. So we're going to anchor to the top at an angle. We're going to set it down right above the kneecap, going out at an angle like this, and then you are going to rub the tape into your skin. As you add friction and heat, it's going to allow the tape to stick to your skin a lot better. Okay, so we have it anchored. Now what we're going to do is we're going to pull the backing off. Leaving the tape on for the bottom of the anchor, and we're going to add a 50% stretch. Now if you look, if I stretch it all the way, that's 100, that's 0. So we're going to add about halfway. The knee will be slightly bent for this, and I'm going to wrap it around the kneecap. The last part, when you pull off the backing, should not have any stretch to it, and you just lie it down on the skin, and then we rub it in. Same thing on the other side. So now when you stand up, it is normal for it to kind of squeeze together here. That's okay. If you have the edges are starting to peel up, just keep rubbing. And as long as you cleaned your skin properly, it should stick. Now for the third piece is to offload the patella tendon. So it's going to go right below the kneecap and we're going to do an upward pull. So you tear about halfway, peel it apart like a Band-Aid. The knee should not be all the way bent while you're doing this, just slightly bent. Going to place it down underneath the kneecap, and then you're going to, as you're bending the knee slightly, pull up into the tape. So pull up. The last little bit of the tape doesn't have any stretch on it. Same over here. And that is what it should look like when you're complete. Thank you for following along. Please continue to follow us for more how-to instructional videos from your H2F team.